Hello everyone, Assalamu alaikum. Welcome back to Dr. Teeth. I am Dr. Hina, a full-time dentist and the founder of Dr. Teeth, one of the biggest platform of dental education online. And today we are going to talk about gum recession, which is one of the most common complaints of our patients. This video will also be made available in Hindi, so if you are more comfortable watching it in Hindi language, I will leave a link to that video in the description box below. So what is gum recession? So when the gums or the gingiva moves away from the tooth, that is called as the gum recession. So in such cases, the patient will be able to see the root of their teeth. They can see some black triangles in between the teeth. They will have certain symptoms like sensitivity, and also one major concern is the aesthetic of the patient. It does not look pleasing. So in this video, we will be seeing the causes of gum recession, how to minimize gum recession at home yourself, and the treatment of recession. So before we dive into that, please subscribe to my channel because it really motivates me to create more helpful videos of this kind. And also, if you found the video helpful, do take out little bit of time and comment below and let me know what next video you want me to cover in dental education. So let us suppose this is our teeth and here we have the gingiva or the gums, okay? So when the gums, they move away from the tooth or teeth, you can say they are kind of leaving the teeth or receding. That is why the name gingival recession or gum recession. So in such cases, what will happen? The tooth will start appearing larger in size, okay? From the patient's perspective, what the patient usually tells us is that their teeth are appearing larger, obviously because the root is also now visible to them. And then we can see some triangular holes between the teeth because the gingiva that fills the spaces between the teeth is not available. So what will happen? This will lead to sensitivity and unaesthetic appearance. If you do not treat this situation, it will lead to bone loss. And eventually it can lead to tooth loss. So there is no point in taking this for granted. Let us see the causes why you can have gum recession. The most common cause is poor oral hygiene. When you don't brush your teeth properly, you don't brush your teeth enough for 2 minutes, or you don't brush your teeth in the morning and in the night, the chances of gum recession will increase. Why? Because when you don't clean, there is accumulation of plaque which eventually gets converted to calculus. So because of that plaque, that calculus, we have so much going on there, so much bacteria there that it can lead to gum recession. Then there are certain group of people who brush their teeth very vigorously in order to keep them clean. That can also lead to gum recession. So you don't have to do it more, you don't have to do it less. You have to do it just enough to keep your teeth clean. Follow proper brushing technique. Don't brush horizontally. Avoid scrubbing. Don't use hard bristles. Use soft bristles. Nowadays, we also have ultra soft bristles. I'll leave a link to my recommended oral hygiene products in the comment section. You can check them out. So you don't have to be a part of the group on the left and you don't have to be a part of the group on the right. You have to be in the middle, okay? Then genetic causes. If you have genetically thin gum tissue, you can have more chances of gum recession. If you are undergoing orthodontic treatment, there are many cases of orthodontic treatment that comes to clinic and they have gum recession. They might not have gum recession in say 1 month, 1 year of orthodontic treatment, but yes, even after 5 years, 10 years, there are patients who have had orthodontic treatment and now they are having gum recession. So that is one more cause. So these are some of the causes of gingival recession or gum recession. Now let us see how can we minimize this at home. Most of them I've already told you, but let's see that in more detail. Coming to the toothbrush. What kind of toothbrush do we recommend? There are two categories of toothbrushes. We have manual and we have electric. If you have proper control over your electric brushes are good. But if you don't get the proper control, in the electric brushes, I would recommend you to stick to the manual brushes. Now, while holding the brush, don't hold it with your entire palm, because when you hold it that way and brush your teeth, you will obviously apply more force on the teeth. So that can lead to gum recession. Just hold it lightly with your fingers and brush. Then, as I already said, brushing technique is very important. Don't brush horizontally. Don't scrub it, okay? You don't have to. It's not a utensil that you're brushing. You have to be very careful because we have soft tissues there. You have your gums there. So brush vertically in this fashion. If you are a smoker, stop smoking because smoking leads to decrease in the blood supply to the gums, which can lead to recession. And the next very important thing is consult your dentist as soon as possible, because in cases where you have plaque accumulation, calculus accumulation, you need to get it cleaned by a professional. You cannot clean in any way at home. All those videos that you are seeing on the internet these days to remove the calculus, they are just playing with your mouth to gain views and to earn money. Don't go for that. From your side, make sure you are maintaining your oral hygiene properly, you are using the correct technique, and consult a dentist for a proper professional scaling and root planing, that is cleaning of your teeth. At least once in a year is very essential. Maximum cases which are in the initial level of gum recession, they simply get back to normal only by scaling and root planing. So this is one of the treatment. In fact, it is a starting stage of any treatment. Scaling and root planing is done in any procedure when we begin with. But if the recession is very much, in those cases we might need to do flap surgery. So basically we take a tissue from your mouth, usually it is from the palate, and we place it in the recession area and we suture it. Then it heals. The patient is on medications and the gum recession gets fixed. In cases where the recession is so severe that it is accompanied by bone loss, then we might need to do bone grafting. So in bone grafting, we try to regenerate the bone by placing bone grafting materials. So that is one method. Yes, in home remedies, you can try turmeric, you can try aloe vera. They can help, but the treatment your gum deserves is a professional help. So don't go by YouTubers claiming to fix your teeth. You might end up harming your teeth than saving them. So if you like the video, please give a thumbs up and let me know in the comment section below. If you have any questions or concerns, I will try to answer every question. I'll see you in the next video. Take care. Allah Hafiz.